Good evening. My name is Renee Moe, and I'm President and CEO of United Way of Dane County. And I am so honored to be able to host Access Hour tonight. I want to do a shout out to Susan Sheldon, who has been a United Way volunteer. And when she approached us to do this show, she said, we talk a lot about racial disparities, and we all know that there are disparities based on race across Dane County and across our country. And she said, we want to talk about solutions, though. As we bring people on talking about we need to do something, what is that something we can be doing? And so tonight, I'm really honored to be able to share a couple of action steps that United Way is taking in direct collaboration with community members, with nonprofits, and with families themselves. For over 100 years, United Way has led in mobilizing the caring power of our community to create lasting change for multiple generations. We've got a mission to unite the community to achieve measurable results that change lives, and we're committed to being a catalyst for inclusion and systemic change. We want to build a Dane County where all can succeed in school, work, and life. With the support of our community, we've spent a century investing in Dane County's most pressing needs and helping families as they work to achieve the building blocks of well-being, a quality education, a family-supporting job that allows access to housing, and health supports coordinated in a two-gen or multi-generational approach. We know there are a lot of great services and programs in our community. There are so many wonderful people working so hard to make change, and we know we're better together. Through collaborative work with local nonprofit, businesses, community leaders, donors, volunteers, and families, we're addressing big picture issues that no one person or organization can solve alone. That is what we call the power of many working for all. As the president and CEO of United Way of Dane County, a lot of times people look to me and they say, oh, that's the decision that United Way is making. One of the things I love about this position is that work really is in collaboration. It's not Renee Moe. This is really about how we unleash, mobilize, and empower the community to change ourselves. Last year, we raised $18.1 million, and those funds are being put to work right now for our neighbors across the community. In fact, we're investing those dollars into 112 local programs and 52 local nonprofits that are working to address the greatest needs in education, income, health, and cross-generational supports, plus another 850 nonprofits that are supported through donor choice. Today, we're going to dive into some of the racial health disparities that exist right here in Dane County and the work being done across our health portfolio. We have strategies and metrics and partnerships across all areas of our impact work, but we really want to take a deep dive into health because Susan asked us to, and also because we know that family well-being is community well-being. We've invited some incredible volunteers and partners to talk about the solutions that we're working toward together. And we know this topic is critically important because when our community health solutions team was tasked with building new strategies to help reduce racial health disparities in Dane County, they found there is not a single measure of local health outcomes that did not display a racial disparity of some kind. Think about that. Not a single measure of local health outcomes that did not display a racial disparity of some kind. That means birth rates, that means infant mortality, that means life expectancy, that means chronic disease, all of those different components. And there was sufficient evidence that our local racial disparities are not rooted in a lack of quality care or programs, but rather a lack of access and culturally safe experiences. The research that we did, the listening that we did, and the stress that came from lack of access and culturally safe experiences directly impacted the quality of health and quality of life for our neighbors, many who have been here for generations. I'm delighted to introduce you to Fabiola Hamden. She's with Dane County and works with immigration affairs and works with our families day in and day out across Dane County. Fabiola is the Vision Council Chair, and that is the committee that is responsible for community impact, working in partnership with nonprofits, making sure that the work we do is centered in family voice, and holding accountability for United Way strategies and how we advance those to make measurable results together. So Fabi, thank you so much for your volunteer leadership. You've been involved with United Way for a very long time. Help me understand, what is family well-being and why does that matter?
Thank you, Renee. Thanks for the invitation. I think family well-being is something that we all seek for. We all wanted to have, no matter how big, how small your family is, or who you call your family, we wanted to have healthy families that they can thrive. And as we are experiencing Now, it is really hard sometimes to do that, right? Because the scarcity of employment, education, the income factors, family or social support, all of that contributes to the family well-being. And we need to really be conscientious or really think about as accessibility. Some families will probably have better access to all these things that we all dream of, and some families may not. And I think it is very important for us to really take into account that. I'll just give you an example. I've been, I immigrated here 35 plus years ago. And so the health system is still very complicated for me to access in my own. And I see with the families that I work with, where language is a barrier, where just kind of living in a different environment is different. So accessing any type of services really, it's hard. And I think with the Vision Council and the community solution teams that are part of this, we are really targeting this type of, or with really making sure that the voices that are not heard are being heard, and then the work we are doing is collective, and we really are partnering with nonprofits and other organizations that are really in day by day contact with families that are struggling.
Excellent. Well, you mentioned community solutions team, as well as what we call the building blocks of well-being: education, income, health, and newer, what we call 2Gen, which is a multifamily approach. Can you talk about how those teams of volunteers work with nonprofits, and how do they do their work?
Absolutely. All of us take a minute and think, what are some of the highlights that we take into account in our lives? All of us, right? We want good education. We want employment. We want it to be income, have a stability in our income. We want to have this family support or social support, and we want our community to be safe. So we all feel safe. So these community solution teams are people that are that live in Dane County, and I, want to think that all of us wanted to live in a very healthy, safety community. So these teams are sort of divided in all these areas that I just talked, where they are connecting with nonprofits working with different in these different areas, and bringing information to us to see how can United Way, how can us, all of us as volunteers and collectively can assist. We have the 211 at United Way, and you have United Way is really connecting with all these other agencies, and to see, okay, tell us how we can assist. And then these teams are really people that are volunteering their own time to meet, to visit the centers, to check what are the barriers out there, and really bring that information to all of us, and all of us brainstorm and say, okay, here are the gaps. Here are some things that we are missing for the well-being of the families. And I think this year, more than any year, we're talking about equitable. What is, what is to be equitable? How can we always talk about equal support, but to be equitable, we need to make sure that people that are not accessing those resources have a easier time to access resources. And I think that's the big component of United Way and all of the volunteers in the community solution teams to work on.
Thank you. United Way is known for getting results and for making a measurable impact that really feels different for family and for nonprofits. How do you know these strategies are working? How do you know that all of those things that you just talked about are actually making a difference?
Right. And sometimes it's hard to see, tangible results. But I got to tell you, I'm a social worker. I've been a social worker for the past 28 years. I did community social work for 18 years, and I did work a lot with nonprofits in areas and geographical areas where really the scarcity of services was huge. By working with United Way and other agencies by collaborating, I saw results where programs really thrive to get the after-school program going. To with the pandemic, we had people that were not getting their stimulus checks for whatever reason. They couldn't really get that, and United Way partnering with other agencies really make that as a priority and start working with these organizations to fund this organization so they can distribute a little bit of money to these families that are still struggling. So there are tons of examples. I think we name some of them in the United Way report, but I think it is very important for us to really sometimes not rush to results, because we wanted to see, especially with our young generation, they wanted to see results right there. Sometimes it takes time, and I think Dane County is very lucky to have United Way and the nonprofit agencies. I cannot get tired of mentioning them, to really work collectively. And I must say that Dane County, we're very lucky to have all these resources available. It's not enough. The work continues and we struggle, but I think if we keep doing what we are doing, I think we're going to get good, measurable results.
Thank you, Fabi. Dane County is lucky to have you too. Truly. Last question. When we think about what it means to have a healthy community, we really think about family well-being as community well-being. There's something called the social determinants of health, which shares that healthcare is really about 20% of health, and about 70% more is really those other social determinants: education, housing, income, surroundings, right? You have the other 10%, which might be biology or environment, those kinds of things. When you're thinking about putting together a plan that addresses family well-being, why do you think United Way is uniquely positioned to be able to help advance not only the action steps, but the community understanding for what it's going to take to really move the needle on some of these challenges?
I think United Way is equipped with volunteers from different areas with great skills. We have, these wonderful hospitals, clinics in town. We're very lucky about that. And then United Way is able to get volunteers and with different skills. We have from doctors to people working as case managers to really address that issue of the differences that we have when we talk about the social determinants. I think you said something one time, we all wanted to live in a place where we can be well and work well and play well, and in a community that's safe. And sometimes that doesn't happen always. So I think United Way is able to really have that facility of connecting with different individuals with different skills, and at the same time bring the community's voice. We have had so many different when we did Cuéntame, what is it, this
Latino
project?
Life in Dane County.
Right. So we just get into this type of projects where if we don't know, we ask, and then you just bringing up this, like I said, these volunteers, having the community solution teams, listening to guest speakers that will come and talk to our groups about what's going on and how we can help is really important. So I think that's one thing that we really we're lucky in the county to have United Way and all the volunteers working with us.
Thank you so much, Fabiola Hamden. We're just delighted to have you here, and thank you so much for your service as our Vision Council Chair, in addition to all the other volunteer roles you play at United Way and across the community.
Thank you so much, and thank you for having me.
We're back now with Jessie Wong and Uchenna Jones. Jessie is an amazing volunteer with United Way of Dane County and the CEO of Metastar. And Uchenna is our health director and in charge of our community solutions team and health portfolio at United Way. As you've heard from Fabiola, United Way is a volunteer-led organization, and we really do rely on volunteers to share their time, expertise, and knowledge to help ensure we're serving the community in the best, most effective way we possibly can. We know that it's through diverse conversations as well as conflicting points of view that we can co-create a shared understanding and really understand different points of view to make the most effective change together. We're really excited to have both Jessie and Uchenna here today. Thank you both for joining me.
Thank you for having us.
Yes, thank you.
Well, we heard a little bit about the macro level of what community solutions teams do. I'd love to hear more about what the health community solutions team specifically is working to do. Jesse, do you want to start us off?
Sure, happy to. So the health community solutions team is 15 people who come together to work towards tangible solutions to advance health in our community. Ultimately, we braid together the wisdom of health and healthcare experts, community voices, and key health stakeholders to advance the United Way's agenda for change as it relates to health. We learn about programs and we fund programs. Essentially, one of the things that we know about Dane County is that it remains a top place to live and raise a family and retire. But for our members of Black, Indigenous, Latinx, Southeast Asian, and people of color community members, health inequities and disparities remain consistent. And the reality is that in Dane County, the color of your skin and the zip code in which you live have significant impact on your quality of life, life expectancy, and wide range of health outcomes. So the Health CST is working to create social accountability by having a group that is not only talking the talk, but walking the walk to reduce racial and health disparities, working really to amplify, to help identify needs, raise up community voices, and fund critical programs in our community.
Thank you, Jesse. Let's move to Uchenna now. What role does the Health CST play in addressing health disparities that we see across Dane County?
Well, piggybacking pretty much, Jesse had said it very, very well. We're a group of 15 members. I guess myself makes 16. We come together, we amplify the voices of the families in the community as it pertains to their health needs. And in that coming together, we come up with some realistic solutions through the supporting of the agencies and by providing the funding that, United Way works all year long to raise. This is one of the ways in which we address those issues and, hopefully really, take the time to attack and dispel some of the racial challenges that we experience, or some families experience, on a day-to-day basis, especially as it pertains to health. One of the things that I want to actually definitely share and make a point of, especially regarding United Way, I love how it's not the work of one person, it's the work of many. And it's very important that we understand that. I think a lot of times when we think of what United Way is doing, we see them as a sole entity, but it's a conglomerate of different entities. And we're just one piece of a big pie. So on that note, we have to keep that in mind. And in the Health CST, we really make it a point to hold on to the stories, to capture real life situations where families are being transformed. And that's what we carry with us. And also using the expertise of the various members, which is very key because we have very diverse volunteers from diverse health settings, in addition to my own, and we all come together. And I love the way in which we collaborate. So it's definitely a collaborative process, it's a very supportive process. And again, we're an organization that listens and responds. I think that's very important. We just don't go out there doing things. We really listen and we take that information, we synthesize that information, we respond and we execute by supporting the agencies that are doing the work, by supporting communities of color, organizations of color as well, doing the work. So.
Thank you so much. And we really value your expertise as a nurse and your direct experience with healthcare that matters greatly in terms of the work that we do together. Jesse, what are some of the health priorities of the Health CST and some of the initiatives that you're trying to advance?
Thanks for that question, Renee. The Community Solutions team is really working with our nonprofit partners across Dane County to advance two key goals. The first is reducing racial and health disparities in Dane County. And the second is to increase resiliency and trauma supports for our Black, Indigenous, Latinx, Southeast Asian, and people of color or BIPOC Dane County residents. We have a variety of strategies we're deploying, things such as developing culturally relevant, reflective, and safe wellness models and programs that are really defined and led by communities of color, making sure our community members are able to go to programming that are really defined and led by people within their own community, having health programs that are community-based and really aimed at reducing health disparities facing the BIPOC community, looking at care coordination for Black and Latinx maternal child health. We know that is a huge disparity we see across our community, and really looking at how we coordinate care, creating culturally safe and responsive mental health programming and having culturally adaptation of behavioral and mental health intervention. Again, you'll see in all of these strategies, it's really about kind of created by the community for the community. And then last, embedding culture brokers, which is kind of a newer term for some, into care teams. Again, really, it's how do we create community-led programming for individuals and family so that we can really engage them in their health and in the solutions and for family well-being.
Thank you. It is a robust portfolio matched with the education, income, and 2-gen teams. So really fantastic. You mentioned care coordination, and I think a lot of people don't necessarily understand, much like culture brokers, what does that actually mean for families? Can you describe what that means in your own words? And I'll love to ask both of you that.
So what I believe care coordination to be, especially for Black and Latinx as pertains to maternal child health, is first of all, assessing the family, hearing from the family what it is that they actually need, and then creating a system that actually takes that information and connects all the health pieces. So basically, if a mom comes saying this is what they need, creating a system that fosters that solution around that mom getting the care that they need. So in this particular case, with ConnectRx being one of the example of one of the programs that we are definitely very much a part of and in support of, we're providing resources to that mom so that she can have the safest possible birth. So whether it's she needs, food, if she needs a lodging, if she needs additional services to make sure her mental well-being is okay, down to if even potentially employment, if she wants to seek out better opportunities for herself financially to support her family even better. We are providing all these additional robust resources so that we can make sure that that mom and that child will have a successful introduction into life and hopefully propelling that family for success. It's a multi-pronged approach.
A multi-pronged approach. I love that. How about in your own words, Jessie?
I think in simplest form, it's really how are we coordinating across our community, across our healthcare system to really meet patient needs and preference, right? The healthcare system is complicated. And we also know that not any one setting of care can really drive a person's health. It's both the community and the healthcare system working in partnership. And care coordination is really, I'd love to say it's actuality, but it's really the aspiration of coordinating a patient's journey through those different components of health and healthcare.
Thank you. It seems like a hard thing to do, but something that's important to do to get to the right outcomes. And I see you both nodding, so I'll say that on the radio. Very good. Thank you so much. One of the final questions I wanted to hear from you about was really thinking through what is family well-being? So we've asked our other guests today about family well-being. What does that mean to you, and why does that matter?
If I can take the lead on this, family well-being to me means putting the needs and the concerns of the family first. So it's not us telling what the family should get, is the family telling us, the community, what it is that they want and how we rally around that family to provide. And in this case, I'm looking at United Way as the community, right? Taking in consideration, hearing the concerns and providing the opportunities and the resources, whether it be financial, whether it be about, coordinating different events, fundraising, whatever the situation might be. But taking all these different entities, because United Way is very resourceful, very good at connecting, resources and agencies together, but, making sure that we are doing it from the perspective of what the family wants, the community wants, the families that we're trying to serve. Because I think we will achieve the goal if we're listening and responding. And I think it creates that accountability on our end, meaning we ask, we hear, we respond, and then they hold us accountable. Did we do what was asked of us to do? So in that regard, I think if we take those things in consideration, if we keep the family in mind while we do the work that we do, then we will meet those needs, because we will hear the testimonials of families, lives being transformed, opportunities being created for families who didn't have those opportunities before.
Thank you. Jessie?
The only thing I would add, Chena mentioned it, or, outlined it so nicely, is really just that when families thrive, impact happens for generations, right? This isn't just about changing the life of one person. This is about changing the lives in our community. And that impacts families I heard one of the United Way staff say this recently, and I'm ad-libbing, but it really resonated with me. When income, health, and education needs are met, families thrive. And wherever you see families thriving, children learning, and healthier lives, United Way is there. And that really resonated with me, right? This isn't about solving for one person. It's creating a better Dane County. And that really is centered on families and family well-being.
And one thing we also do is that we're doing it in real time. It's not information that was taken 5 years ago and we finally mustered up everything we need to get the work done. We are doing it in real time. So we're also seeing real time outcomes. And I think that's really exciting. And that continues to encourage us to move the work forward.
Yeah. And in partnership, right? It's also in partnership. It's not just it's not any one person that can do this work. It's impactful, real time, and in partnership with our community.
Absolutely.
Powerful. So powerful. Thank you both so much, Jenna Jones and Jesse Wong. We're so grateful to have you here today. What marvelous testimony. Thank you for sharing that with our listeners.
Thank you for having us.
Thank you.
We couldn't do the work we do at United Way without our incredible nonprofit partners. Here today to talk about what she's seeing at a community level and the incredible work her organization is doing to help tackle some of the inequities we've discussed today is the founder, CEO, and president of the Foundation for Black Women's Wellness, Lisa Payton Kerr. Hi, Lisa.
Hi, Renee. Thanks so much for having me here today.
You bet. I'm so excited about it. Tell us a little bit about your organization. What's your mission and what work do you do?
Yes. Well, as you know, Renee, as such a close partner to the Foundation for Black Women's Wellness, we are a community-based nonprofit here in Dane County who exists to explicitly empower a generation of well Black women. And a huge part of our work is to address the persistent racial, health, birth, and economic and social disparities that have really challenged Black women and communities for many decades now in our community and our state. This work is really imperative. As you know, in our community and across Wisconsin, we've been battling a track record of racial health disparity for so very long. And so our organization has been working around that issue for the last decade. Many don't realize that we have been doing this work for 10 solid years, starting at the grassroots level and progressively growing that work that's really rooted in three things: education, around health promotion education, advocacy, around transforming how healthcare looks, and developing the leadership capacity of Black women to not only improve their lives, but to become advocates and leaders in the space of improving Black women's health.
That's so inspiring and such important work. And congratulations again on your 10-year anniversary. It means a lot to see an organization with great vision and leadership like yours grow and to just see that impact amplify. One of the things I'd love for you to talk about is how does United Way help to amplify your impact? I think a lot of people think of United Way as a funder, but don't necessarily understand the other ways that United Way partners. Would love to hear you say that in your own words.
Well, you know what? I can't underscore how important it is that the United Way is a funding partner to the foundation. And why I emphasize that first is that so often it's the case, Renee, as you know, that community-based nonprofits, we're doing work in the trenches every day with some of the most underserved members of our community. And when you're talking about racial health disparities, birth disparities, and all the economic barriers that are rooted in that entire issue as to why these issues persist and continue, the work takes many, many strategies. It's deep work personally with people one-on-one. It's also systemic and structural work where you're working to change how systems respond to communities. You're working to expand resources and access to things that you have to partner with larger systems to do. And it takes dollars to be able to grow beyond grassroots, to become the type of mature organizations we have to be to stay in this work. And so United Way being a funding partner has been game-changing to our organization, especially this last year as we've grown the depth of our programming to really drill down in some of our highest need zip codes across the county, where we know that birth, health, economic disparities are greatest by the numbers. And so we're really appreciative of that because it allowed us this year to launch a community health worker program that we've been designing for several years and needing resources to help us implement it into practice because our community demands and needs that presence. So have to understand underscore the importance of funding. And also, you guys have been there with us and for us for quite some time. We all have been impacted by the COVID pandemic. And at the height of that pandemic, United Way really responded in releasing funds directly to community-based organizations who are closest to community members. And the Black women and families that we serve really, just absorbed the brunt. Everyone was impacted, but the deep impacts to Black women, to their families, the loss of employment, the safety concerns where mothers had to decide between going to work or staying home with their children and what that meant to their income, the layoffs and all of the things, the deaths, that disproportionately impacted our families. There was a lot of work that we needed to do. And we were able to partner with other local nonprofits who the United Way funded as a collective to get dollars out to families who were most in need at that crucial time where they needed to keep their lights on, where they needed, if they were still working, to get to work, they needed transportation, they needed food, they needed basic things, they needed information on how is it safe to go to the doctor? Can I go? Where do I get information about testing? All those things we were able to construct a response, an emergency response, because of the collective funding approach that you all took to making sure that organizations like ours were able to mobilize dollars and support out to the community. And then just the community of connection and the network of how you bridge organizations like ours to others in the community who are doing similar work. We can talk about strategies, we can talk about best practices, and we can talk about big solutions. One thing that we know is that we can't piecemeal our way through solving some of our community's biggest challenges. And we often operate in silos. But you all are like the convener, right, of all the organizations in our county who are doing work that impacts families, mothers, children directly. And it creates a community of sharing best practices, thought leadership, and visioning in a bigger way what our county and community can become if we begin to collaborate and answer big questions around root causes, and then how do we mobilize ourselves collectively in the United Way spirit, working for all together. That's been a blessing for us to have access to that community.
Thank you. Wow. That is, I often feel proud of our work, and thank you so much for lifting up that collaboration and partnership, and a shout out to all those donors who make that funding possible, as well as our awesome strategic collaborations team who goes after so many grants in partnership with nonprofits like you, great leaders like you, and that work as a catalyst and convener. Thank you. What does all of that partnership and looking at the big picture and trying to really row more together mean for our families? What does this work that you're doing mean for Dane County neighbors?
It means everything. We've talked about the challenges in our community. We've chronicled all the barriers and all of the incredible disparities for decades now. I told someone the other day, we've been writing these reports for 30 years. And we often forget that behind the reports and the data are people. Right. And so it means everything to our community that we're able to translate what we're reading and writing in reports, and to speak to those issues at the tables where those in leadership and decision-making roles can hear it and then understand how they can respond to the needs of community. And that points to your previous question around, what is the support and the benefit of being a partner to the United Way? The exposure to tell our stories, the exposure to break down and educate power brokers, decision makers, employers, systems who you all are bringing to the table, who may be a few steps removed from the trenches of community, and being able to illuminate and elevate the voices of everyday people to say, this is what is happening in my neck of the woods. This is what's happening in my zip code, my neighborhood. And how do we create an awareness that then drives different decision making, that drives different types of investment? That is the power and the value and the critical nature of why having this table of United Way is so crucial, is that we're able to connect parts of the community that are disjointed from each other, and to do truth telling that then drives action that's informed